Yeah, but like nearby.
I guess I need to share that. Okay. So let's see. So skin grafts. You guys have heard of skin grafts, and we'll go over them in detail. You know, how they take a piece of skin from one part of the body and put it on another to cover up burns or just deep wounds that need, you know, that aren't going to heal. So usually it's something that needs a little bit of help to heal. Usually it's not going to be something that's cosmetic, you know, because they don't look pretty when they're done, because regardless of, even if you're taking it from yourself, that skin never looks the same. I don't know if you guys have seen like burn patients who have had skin grafts. It's like always you can tell because it's a different color, and that's how it is. So the different types of dressings that they'll use on that, did anybody cover that? Let me see.
That's very good.
I'm not seeing anything, and nobody's saying anything, so probably they didn't. Lots of stuff about drains, which is nice because drains, there's a lot of them. It looks like Katrina covered some dressings. So the first layer is a contact layer, and that consists of 3 types. So non-permeable, Vaseline gauze, zero form gauze, and a lot of times like on skin grafts, they're going to use the zero form gauze, which has like a betadine solution in it, and they'll put that on the top. And then of course it kind of depends on the doctor, but they're probably going to put some 4x4s, maybe an ABD, and then tape. There's tons of different types of tapes. We've got some of the tapes in the lab. I mean, we probably have about 10 different types in the lab, and there's even more than that. Just it depends. One thing they want to try to help to do, which doesn't seem like it whenever you guys go and have immunizations or whatever, and they put some kind of dressing over it, they want for it to be comfortable when it comes off. And I know it always hurts. To me, that hurts more than the shot. But there's tape that will help, and it won't stick to your skin, or it'll stick, you know, to stay on, but not pull off your hair. So anyway, and of course patients some are allergic to the different types of tape, so they got to use paper tape or different, something different. Semi-permeable, so Exoderm, Nu-Gel, Aquagel. I haven't used those. Permeable, Telfa, Adaptic. Those are very common. Adaptic, it comes in the pack a lot of times. It's kind of like zero form in that it has like an antibiotic type solution in it. You can feel it. It's kind of greasy. They'll put that on the wound first, and then again 4x4s, ABD, maybe some kind of a soft roll. Just kind of depends on where it's at. If it's on an extremity, it's easy to wrap. If it's on your abdomen, then they got to put something that can stick on there. Most of the times, the layers are going to depend again on what you're having done. Like when you have a lat chole, they may not put like really any dressing. A lot of times they'll just put like steri strips on there to hold the edges together. They might put a Telfa just to cover it, and then maybe some tape. It kind of, again, it depends on the surgeon what they like. Others will just put the steri strips, and that's it. And then they have glue that they can use. They'll glue the skin. If it's not a deep cut, they'll just glue it. And a lot of times they're going to put Telfa or something over that just to keep it clean. And then you don't have to do anything as far as, you just wait for it to fall off. And the glue that they use is almost like super glue, and that it sticks really well. So it takes quite a while for it to wear off. But once it's worn off, your wound is healed. And then I gave you guys examples of 3-layer dressings. So again, most of them are going to be 3 layers. Pressure dressings, what would those be used for? Usually pressure dressings are used for large wounds because they want to keep pressure on it to keep it from coming apart. Okay, or it could be a patient that is more likely not to heal as well as somebody else. Uh-oh, our time's up.
Sorry. Sorry.
So they'll put a pressure dressing. And that also kind of helps. If you can think of it, just something that kind of holds things down. Bulky dressings. Bulky dressings can just be 4x4s that they fluff out. So they'll get just a regular 4x4. And you guys know what a 4x4 is? Yeah. So it's just, yep. And they just get them and they just kind of fluff them out. They call them fluffs. They'll do that. And I'll go in the lab here in a minute and grab just an example of some of the dressings that you'll see.
Would that be for like the fluffy, more ventilation?
For what?
Ventilation?
Yeah, and also just kind of have something soft, something covering it, but that's not putting pressure. It's just kind of there. I'm trying to think who uses fluffs. I can't, there's not like a certain thing that I can think of that uses them. They'll just ask for them every now and then, just ask for you to make them fluffs. Then rigid dressings, somebody covered that. Let's see.
Casts and splints.
Who was it?
I just said casts and splints.
Oh, yeah.
I don't know.
I did a section.
There we go. Look. So they're like casts and splints and can be made of plaster or fiberglass. They can be put on wet and dry. Most of the times they wet them because when they dry, they harden. So they wet them. They'll bring a bucket of water in the OR, whatever they need to do, sometimes just a spray bottle, and just wet them down real good. And then they put them on however they want, wrap them good with an ACE, and then they stay in place. So they're generally used for broken bones. They're meant to stabilize and protect the break to allow the bone to heal properly. Splints are more like a half-breed cast, hard and firm on one half, offering support and prevent an unidirectional of limb, such as an arm or a wrist. So the hard part is supportive and generally held in place by a bandage or some kind of an elastic wrap, so like ACE, and can be removed by the patient. Plaster has been used for many years for things like casting legs, arms, and other appendages to prevent mobility. A lot of times they're going to use casts on kids so they'll heal properly. Many times when kids break something, they don't fix the break, they'll just cast it. They just put it back in place and put a cast on it because kids heal, their bones heal. So they don't need to put a plate or screws or anything in them like that. So they'll just bring them in and give them a little sedation and just put it back, whatever it is, back in place, and then cast it. Fiberglass casts are lighter and can be wet if the right kind of padding is used, and that's important too because somebody's going to be wearing that for a while, so you want to make sure it's not rubbing on the rest of the arm or leg or whatever, wherever it is. So it's as comfortable as it can be, because I mean they sweat and itch and everything else. People are all sticking hangers in there to try to scratch stuff, so they're not comfortable. I've never had one, and hope that I never have to. They're cleaner to put on in the doctor's office, and you can see the bones better through fiberglass cast than you can through a plaster one. Plaster is also heavier, so if they were going to x-ray it. Plaster is also heavier than fiberglass and not water resistant, but it does set up faster. So yeah, they'd have to hold it in the desired position for a longer period of time. And Danny said as a child he broke many bones, had several dislocations of joints, and it all kind of went through trial and error with him. See if he could re-break it. And you know, once you break a bone, that bone heals stronger, and you should never break it in the same place ever again, because it heals, those ends heal really well. Yeah.
Actually, I didn't actually break any bone twice in the same place. It was always different.
Yeah, it was someplace different.
Yeah,
Huh?
someplace different.
Plaster cast, I guess this is my experience, is easier to destroy and crumble. Yeah.
Not hard. Couple good solid shots on the side of the bathtub. Gone.
Oh,
So
yeah, I know a lot of people will try to take them off themselves, which, whatever.
that's why we went to fiberglass cast. She said, try and break that. I couldn't.
Oh, well, good, good.
I was like,
So there's different types of dressing. So bolster dressing, a dressing that is sutured into position. The bolster dressing may be referred to as a stent dressing, over the tie over dressing. So it could be placed over skin graft recipient to give it even pressure and to prevent fluid from accumulating under the graft. So long sutures are placed lateral to the wound edges, and the suture ends are tied over the dressing to secure it, which when you see it, it looks painful to have that type of dressing, you know, because they put whatever and then they suture over it. So it's sutured to the skin, basically. Wet to dry dressing is gauze is soaked in some kind of a liquid. A lot of times it's normal saline, could be antibiotic solution. Dakin's, do you guys know what that is? Dakin's solution. Yeah, it's a bleach solution, and I've never seen them use that. So.
I've heard of it, but
It's performed on burn wounds and may be performed under anesthesia in the OR to provide patient comfort. Yeah, I've never dealt with burns because anytime there's a bad burn patient, they send them to Albuquerque because they don't have a burn unit here. I know I've heard that when people get burned that they have to go in and they basically use like a scrub brush to scrub off their skin, and this is done usually like every day. So they give them anesthesia. They go through the pain, but they don't remember it. Otherwise, they'd be like, forget it, just let me die. Because, yeah, it's pretty bad. I don't think I'd ever want to work in that kind of environment. It's bad stuff. Wet to wet dressing, wet gauze is applied to the wound and is changed before it dries. So it helps provide minimal wound debridement and causes the patient less pain than a wet to dry. Thyroid collar for neck. It's applied to and secure dressing over the thyroid incision. So they have like special, to hold it in place. An ostomy bag is applied over the intestinal stoma, and it contains the excretions. It's attached to the patient's skin with an adhesive that is incorporated around the edges of the bag. You guys will more than likely see something like that. They're somewhat common. Drain dressing is a gauze sponge that is manufactured or fashioned, and most of the times we would just cut the dressing to go around the drain, and it's a Y shape. You cut a little Y in just a 4x4 to just go around the drain to hold it in place. Tracheotomy dressing is a drain dressing. It's placed around the tracheotomy tube, and the tube itself is secured with wide umbilical tape. Yeah, there's like holes in the tracheotomy dressing that you can tie it into place on each side, holds it. You don't want that thing to come out. Yeah, they have like Velcro fasteners so you can tighten it if you needed to. Then eye pads are oval-shaped gauze applied over the eyelid. Then the eyelid shield is rigid, so that way it keeps you from accidentally hurting your eye in any way. Perineal pad, a peri pad, which is what we call them, is used to absorb vaginal or perineal drainage. It says it might require the use of a belt or underpants to keep in position, and they do have like special underwear they can put on the patient if for some reason they feel like that patient won't be able to.
What they make you wear after you deliver?
Yeah. Yeah. So anytime that you do like a GYN procedure, you almost always put a peri pad on that patient. And then anal procedures, they'll put a peri pad on the patient. And sometimes they'll put special kind of like tight underwear to keep them on, keep that pad in place. Packing material is used to assist with hemostasis. It provides pressure, support of the wound, and eliminates dead space. So it can be gauze, 4x4s. Gauze comes in a little container, and basically you get a pickup and you just pull it out. And they use the gauze when they do like nose sinus procedures, and they pack. It's amazing. You get this long piece of gauze and they stick it in there. And I've heard from people who've had sinus procedures that that's the most painful part, is when you have that taken out. They'll also put like they call it a nasal tampon, and they stuff it in the nose. And of course it swells up and stays in place. It's got a string, and they tie the string. They usually put two, one on each side, and then they'll suture it in the middle to hold it in place.
What's
And-
that for?
Like when they have a septoplasty or something with the sinus.
Wow.
Yeah, those look pretty bad. And then we go to catheters and tubes and drains. So there's a variety of catheters and tubes, as you guys found out. Let's see. So Nicole told us that there's varieties. There's urinary catheters, intravascular, specialty catheters that infuse fluids, might help to obtain diagnosis, monitor body functions, and remove thrombi. Angiocath, which provides peripheral access. Specialty catheters such as a cholangiocatheter. It's a plastic catheter with a small lumen and a port for attaching a Lorlock syringe. You guys remember what those are, right? Did I show you those? I think I brought them in here, but I don't think I showed you, huh? I'll bring them back. It can contain dye, and it's inserted and injected into the common bile duct, and then that's when x-rays are taken. So when they do lap choles, they put a cholangiocath. They make a little incision and put that cholangiocath in, and then they put contrast, and that'll show up on x-ray. So if it goes all the way through, they know there's no stones in the common bile duct. Most surgeons will do those for lap choles, but then there are a few that don't think it's necessary and they don't do them. Yep, and then of course there's urinary catheters. Dyes like Hypake and Rhinographin, that's kind of what a contrast is. It's a dye. So before I forget, I'm going to go ahead and go grab a few of those things I told you about, some dressing, syringes, and then I'll see what I can find as far as these drains. So I'll be right back in just a minute. It was funny because you guys were talking one day that Jennifer was watching the Zoom, and she said, I heard them talking about something. They were kind of whispering. I didn't quite get it, and I said, "Oh, was probably not anything that that you guys wanted to share."
So she did tell them.
Yeah, she told me. She's like, I don't really know what they were talking about, and I said, I probably didn't want you to know. Well, here's a couple syringes here. So this is a Lorlock, and you can see it just cut. You can just twist it on something, and it'll stay there. And then this is a slip tip. Okay, so you can just slip it on. Slip tip.
What's the difference between how they're used? The different, like an actual screw on and just specific things that they have to use this one in these cases and need to use this one in these cases, or is it a matter of preference?
They use Lorlock a lot. So just for injecting anything really. So even when they do like the contrast, they'll use Lorlock. Just because it won't fall off the catheter end. Even when they just give you an injection, they'll use a Lorlock because it locks onto the needle, so it doesn't fall off. Slip tip, they do use them sometimes, like for different types of catheters that they need to continually go back and fill it up.
Fill it up and just...
Yeah. So I'll be right back. Don't talk about me because I can listen to it later.
The test, don't tell them. Or don't remind him. Oh yeah. Take the same as all the world. Yeah, that's cool. And the middle thing, where did you get yours?
Mine was given to me by my grandma.
Oh, see, I got mine from my
Oh, these are great, aren't they? That's cool to get up out a little early so we can start working on this.
Right. That'll be nice.
Six. Yeah, I get out. I think it's 6. Go work 7. Yeah, it's lab. And I still was straight after work. And we were there till about 10.
Okay.
Tuesdays and Thursdays.
Yeah. Long days. Really long days, huh? Really?
Start reading.
I think about
I feel like staying up and then I
Oh, no.
started something like that too.
School.
Oh, okay,
It
nice.
makes it easier. Okay.
Right. Yeah. Really? How old are your sisters?
Yeah, actually, the youngest is 10 years old, and this is 10. And then the eldest is 22.
Yeah. What were these called again?
It was a warlock and a slip through.
Slip hit.
Slipped it, yeah. So,
Slip through.
Close enough, right?
And what do they use?
I would say we're for medication and maybe like the catheter.
Yeah, I was wondering if that would be together.
How old are you?
31.
Are you?
You guys
We
want
went
to
to
see
the same school though, did we? Although I technically wanted to be Scorpio.
That's
Yeah.
cool.
That was yesterday.
He's Scorpio.
You weren't here when we were talking about that.
Yeah, we're in the same class.
We're over it now.
Yeah, it's a new week, it's Monday, the next game is on Sunday, that
So they
week's
can-
over.
So they can lose again.
Oh,
Oh, we're doing good.
Cheers,
That's
cheers.
good.
Just kidding. It was heartbreaking.
There was a
I-
big victory, Aaron Rodgers made up last year.
Did they win?
Yeah.
Did they win?
Yeah, in overtime.
I
Oh,
don't
can't
know.
remember the teachers'
No.
names.
I was switching channels back and forth, so I was watching all of them, but a really good one I thought was Atlanta's game.
I
Not
know
Miss
this
Norman, right?
Let's see, I don't think I watched it. I didn't
I
watch
don't
it.
remember the.
I don't remember which one I watched, but I was.
I don't remember.
Sundays are hard, because I watched like
Yeah.
3 games, I can't remember.
I know, and I
Except
thought,
the Green Bay.
and I paid somebody a ticket, cause it's like, you want everything.
Yeah, sometimes on Thursdays, I don't get the games.
It's
That's like on
local, isn't it?
ESPN. Should have been ESPN.
I do, but
Oh, Jenner.
yeah, sometimes I don't get it.
Okay.
Like I had it, last week was on channel 16.
Oh,
wait, what do
you?
you-
Right?
Hey,
But
But a couple weeks ago, I didn't have Thursday.
I like those how much
Yeah.
it is like, it's like, I hate reading this stuff like that, so I'm
And
like.
then channel 3
Yeah.
or something like
I know that one.
I know it's ESPN is like.
Mine is when you
Yeah. I'm excited for it, but it's not yet.
that. That Green Bay game, I was getting sick, I thought we were gonna lose again. And
And
then,
I wanna like.
last 7 minutes of the fourth quarter.
I don't know, I was really sad about stuff like that.
Classic Aaron Rodgers.
Fishing right after. I do love their yellow also.
I know.
I
Yeah.
hated the Andrew looks. Yeah. I was thinking about writing the week, and I thought those were worse, but I love the one with Betty Matthews, very sick. And just sitting there with his hair down, I'm like, oh my gosh, she should just wear like that all the time. But I'm not a good man.
Yeah,
I'm just curious when it comes to stuff like that, because I hate like feeling.
That was
weird
very-
when I
well,
get
it's not
very
gonna
sad,
like what the outcome was.
Yeah, it's hard to even pay attention.
Yeah, I'm like, what was up? Like, these last 2 weeks.
I
Right?
flipped over to NFL.
I'm
Oh,
pretty sure.
we're looking up like these Jews crazy.
Lost today too, and I'm
And then
like,
watch the Chiefs. Did they win? My,
because
Yeah,
I was
we're
doing
like,
oh.
really
Yeah.
we were good this year. My cousin and my dad,
Scratch
and
my
my
hair.
brother-in-law.
But
So,
I do love Travis Kelce, I'm not gonna lie. I love him. Other than that, but no, like, yeah, they're really good. It's something they lose.
I know.
So if the Raiders won, we would still be number one in the AFC West, which didn't happen.
Yeah.
And now it's.
I was hoping that they lost yesterday, that way we don't, be like 2-1.
I know.
You're Broncos, right?
Yeah.
I mean, they're gonna have everything.
You would just.
It was a sad day yesterday.
So here's some dressing, okay? Just a small example. This is soft roll, and this is what they use a lot of times for casts.
Recognize that.
So like when you give blood, what type of dressing is that?
Isn't that the sticky one? Because I know whenever I take the bandage off, it's sticky.
Sometimes they might put a
That's
little
like,
piece
you mean
of
the
that.
outer that they
Yeah.
wrap with? That's like a small ace, that elastic stuff.
Yeah, it's kind of like this.
There is a specific name for it.
Coban.
Coban.
Yeah, go back.
Thank you.
Yeah.
Coban.
Jelly green though.
Yeah, so there's Coban.
Sticks to itself.
The
And,
option is wrapping green.
it's pretty tough.
They're 4x4s, of course.
These are the 4x4.
Yeah,
Are those the ones that they fluff up?
yeah, so they can make fluffs out of those. Then this is an opsite, Tegaderm opsite. So when they put it on, basically you don't really see it. It's kind of like a clear Band-Aid. And then these are the steri strips.
Don't they use these or something sometimes to hold IVs in place?
Yes, yeah, they do.
Oh, yeah.
And then these are steri strips.
Oh, yeah. My youngest son is well associated. So my youngest son's well associated with those, unfortunately.
Yeah, so steri strips, yeah. So these are what they could use instead of stitches.
Stitches. They're at the-
Just to kind of hold things
Is that like the
together.
same as a butterfly?
It's similar.
Yeah, I
Similar
guess it's
to a
similar.
butterfly. It's not the same, but it is similar. Yeah. Yeah, they just kind of hold the skin together.
And then this one's Telfa,
That's
Telfa.
Alpha.
So it's shiny and it doesn't stick.
Oh,
stick
yeah,
to
it's just a,
They like put
yeah,
ointment
Yeah.
on that sometimes.
Yeah.
It almost doesn't.
Yeah.
yeah.
It's like it was taken off.
Yeah.
It's
It's
the
like
bad
the-
part of,
It's the part of the Band-Aid.
yeah.
Yeah, it is.
Yeah, it is.
So like when they do skin grafts, they'll put that Telfa on a lot of times. And this is Adaptic. You guys can feel it. It's kind of slick.
What?
Adaptic.
Some these too.
This is an ABD, abdominal pad. Okay, or you'll hear them called ABDs, just short for abdominal.
They'll show us those ones.
These ones.
It's like, it is.
Yeah, we checked
And then this is like nasal packing, like I was telling you. You guys will get like a pickup and you'll just pull it out and cut it to whatever length. Always plenty. Yeah, whatever length they want.
Plain package. It's called nasal.
And that's what
Nasal
They
packing.
put them in there, yeah. So usually I just get 2 strips about that long.
They stuff it in the nose.
And yeah, they will soak it in, they could soak it like in a cocaine solution. That they'll stick in the nose, yeah. Yeah, of course, as you can imagine, it's very monitored.
They wake up going, "Hi, everybody."
Okay, that was adaptive. And then this one here is Zero Form, so it's kind of like adaptive. It's just different colors. If I can get it open here.
Who posted a picture of that biologic dressing? You guys see that? It was like the
Oh,
person's
on the
heel.
foot?
Yeah.
Oh,
I was gnarly looking.
So that's Zero Form, okay? So that's a little different than that adaptic.
I don't know.
Oh,
Oh, is that what that is? I don't know what it's called.
Yeah. Wake you up.
Oh.
Yeah, it kind of has a smell.
Well, those are your passive drains, right? Those are an example of passive drains.
Yeah, and I brought one in here, a Penrose. Pretty common. So this is a Penrose drain. So when they're doing like inguinal hernias, they're going to use a Penrose drain to go around the spermatic cord, basically. And it goes around it, and they'll clamp it. They use it as a retractor. They just put it around it, and
Just to hold it back.
just to hold it back. Yeah, because it's soft and it's not going to cause any damage. So that's Penrose. And then they'll use Penrose for other things too.
What was this one called again?
That's Ace.
Oh.
This is the one that's different, Hoban.
Okay.
Did you guys see that one?
Yeah.
Hoban. Yeah, and it's like, how does that work? They'll put it around stuff just to kind of keep it in place, more temporary. So it's not something they use permanently.
So do they use like tape to put a lot of these on, or what do they use?
Yeah, yeah,
What
that
was
was
that,
the
some
tape.
shit?
So
Is that a
like,
tourniquet?
this is just hard as a thing, but it's, okay, so it's soft.
It was just a very
Yeah.
tourniquet material that I use elastic.
Yeah.
Maybe it has a lot of.
It sounds like what you would use.
It's rubber, it's stretchy, and that's what it uses.
If they're gonna pack it and leave it open, something like that. I'm trying to think, Webril, what else they call it?
Oh.
Can't think of what else. But anyway, it's just another type, instead of using that soft roll, they use this. So this is really common, like on extremities.
They use this, they also use this, right after you get that, the soft part, then they'll go around with this
Yeah,
before they do the fiberglass and plastic.
yeah. They'll put soft roll and then they'll wrap
And they'll
that
wrap
around
this
it,
around.
yeah.
Unfortunately, personal experience.
Oh, yeah.
It's not good.
And then this is a type of like a hemovac. So this spike right here, they will sometimes use it, but they'll, if you guys look at it, they're very sharp, and they'll get a hemostat or a blade, and they'll make a little puncture wound, and then they'll stab this through, comes out, and then they attach that drain wherever, the incision's at that they want to drain. And then, of course, here's what attaches. This end here
That's
will
supposed to be like a
attach.
pretty strong suction according to description. Oh,
It's not that bad. I mean, it's just kind of gradual. And so, of course, they just put this on, and then it fills up, and so it gradually releases. So you guys can see how that works.
That's cool.
Webril. Web. Here's that cholangiocatheter I was telling you guys about that they use when they do when they're checking for a stone. So they make a really small incision, and then they're going to take, and this is laparoscopic, they take that end and stick it inside that incision, and then they send the Conray through this.
Is that like the tech they would use for like an inpatient or is it something?
I don't know. I'm not sure.
What did you call it?
That one is a cholangiocatheter. Here's that spike that goes with that.
This goes with.
That's what
Oh.
actually
Oh.
sets inside the patient. So that other end sets inside the patient, and then those holes that drains out. That spike is what they use to thread it, basically.
So you put this on a syringe,
Yes,
what'd you call it?
cholangiocath.
This is
Torture devices.
danger. Yeah, professionally used torture devices.
Thankfully, all those things are usually used when you're asleep.
Oh.
So this is a Lorlock, and you guys, we can take it out of this package. It's a control syringe. Because they got these little,
Oh, okay.
surgeons like it. Just for injecting local or whatever.
Just better control.
Yeah.
This has the, what you call the screw on.
Yeah, what is that called?
There's one
Yeah,
slip.
me too.
It's not the slip on. Oh, lock.
Lorlock.
Loylock.
Lorlock.
Loylock.
Try not to give it in.
Loylock.
It's got a little twisty guy.
Yeah.
It's a little
I
twisted.
thought it was
Loylock.
Lorlock. Yeah, Lorlock.
And as you guys can imagine, syringe come in all sizes, from really, really small to really big. And it just depends. When they're pushing like fluid, they're gonna use a big syringe. But if it's a local anesthetic or something, they use something small, but they can really measure, exact amounts.
I could never find what a ureter scope is used for. Those on the study guide.
Like your ureteroscope?
Oh,
Oh, okay.
ureteroscope, sorry. I wrote that wrong.
What number is that?
That
I think
is,
it's somewhere like
8.
is used to look in the renal pelvis. Renal pelvis.
Look at the renal pelvis.
But what body orifice would it go through?
I just put renal pelvis. Okay. Usually, your ureteroscopes go through the urethra. Yeah. Yeah. But I think maybe the question is more as what are you viewing?
what would this use? This one be used for?
That goes with that drain.
Okay.
Okay, so what they do is they stick that part's what lays inside. And that thing, if they want to, you just stick it.
Yeah.
Well, like
That's
just
basically how they
your
spread it.
sleep.
And they just
Just
Yeah, that's where my
sleep stuff. Thank you.
Yeah, so whatever it
I think
is.
it's so much.
Okay, I have little holes that goes into that. Yeah.
So this end stays in the
They'll cut it to whatever, however length they need it. So a lot of times it's not real long.
Sure.
It is very short. Put all this stuff in here. So what's this one?
Yeah, happy that.
What is that one again?
Cholangiocatheter.
The one checking for stones,
Right, yeah.
And then it just inserts the dye. Is that what you're saying?
Yeah, so they push the dye through that. and it goes inside.
So that would take a slip on.
I don't think so. I think they use a Lorlock on it. You've got like 2 or 3 different syringes when you do a lap chole. So yeah, they usually do a Lorlock on it because X-rays in and they want to make sure this doesn't slip off. Sometimes with those slip-on, they, you put any pressure and so like this isn't going to come off. Yeah. Yeah, so of course, if you use that, you have to you'll cut that end off and that goes in the sharps. When you're done with it, consider, of course, a sharp. The holes are, so that part of the catheter is what stays inside the patient and it hooks to the end of this. So this here, it hooks to this end.
Oh, so they just have it.
So all those holes
So
are drawing in fluid.
Yeah, so the holes basically are what are suctioning up the fluid into this drain here. And then they can, of course, take off this and empty it out and then set it again.
What kind of scissors do they use to cut that?
Bandage. You usually get a pair of bandage scissors in your tray. So stuff like that. If you're cutting dressing and things like that, you should use your bandage scissors. If nothing else, you could use your suture scissor.
All the goodies.
Let's see what else is on here. Look, Kristen gave us a picture of that cigarette drain. So basically it's just some kind of a gauze that's put inside and it just helps soak up. And I can't say that I've seen them use it before. I've seen bolsters and a lot of other ones, but not that. A nephrostomy tube. It's inserted percutaneously into the kidneys to remove urine. Yeah. So like that.
Would you have one on both sides or what?
They can be on both sides.
Hmm?
They can be on both sides.
I guess. I don't know. I would think they would only put it on one side.
I've worked with somebody who
Had it on
Your
both
kidney's
sides.
Still making urine.
Yeah. So this is an example of a passive drain. Allows a pathway for fluid or air to move from an area of high pressure to one of lower pressure. One thing I didn't find in the lab, I'll have to ask Dale when he's here tomorrow where a few things are, because we have chest tubes and the trays that, everything that you hook them up, because those are, of course, drains to remove any air fluid from the lungs.
Right where it's closed in there, that's where the rear scope would be looking, right?
Yeah. So those are some reasons why they would use one, to remove or dissolve renal calculi, to obtain direct access to the upper urinary tract, to diagnose ureteral obstructions, to deliver chemotherapeutic agents, provide prophylaxis after resection for chemotherapy patients. Yeah, they probably would put it through the side. I think this is the patient side. So that's kind of an example of that one that I showed you, just that tube coming out. And of course, anytime there's something coming out of you like that, a tube, they have to be really careful for infections. They don't want to leave them in very long. So usually, they leave them in for a day or two at the most and then take them out. They don't want to allow a passageway for infection. Let's see, what's this? Oh, this is kind of like that gauze, that's got stuff in it. That's what that looks like. So biologic dressing. So zero form or something. Oh yeah, and that's the bottom of the foot. And this foot actually looks pretty good. You'll see some that are terrible. Yeah, they're like, wow, how do they even have that foot still?
That's all like what they use on ulcers and stuff like
Yeah.
pressure ulcers that people get in the nursing homes.
Mm-hmm. Yep. But yeah, you guys will most likely see probably at least one patient that is having a leg amputated. It's usually legs that are amputated. Shana and her Grey's Anatomy.
Well, no, that wasn't me. That was one episode I saw. And I was like, that is pretty cool. I don't remember what she wanted, but she was like, there's a pig or I think it was like a sheep or something. I don't know.
I think it was a
It
cow.
was an organ. Yeah, I don't know
Yeah,
which one it was. I was like, what? I saw that and I'm like, hey, I remember I saw that episode.
Wasn't it like a heart valve?
Yeah, heart valve, I think. Some lady was like,
Grandma's a good heart valve.
really?
That's awesome.
Yeah, that is. It's amazing what they can do. Let's see. Shana did a really nice job here.
I couldn't insert the pictures. I tried and tried, but I thought the coolest one was the top one. With I saw one on a nose. Oh my
The
gosh, it was awesome.
bolster?
Yes.
Well, let's see if we can find one real quick.
But a bolster on the nose, like the tip. It just looked like, I don't know, it's cool.
So yeah, that's what it looks like. This one?
No.
No, a different nose.
Yeah. If you scroll down, it might be down there. I guarantee it. It's Barnacle Boy. Okay. Right there. There it is. The one with 3 pictures to the right of that, where you are.
Which one?
Oh.
No.
Oh,
down to the right.
To the right, immediate to the right.
Yes. That's the one I wanted to attach.
Oh, this
but I
one.
didn't. Yeah. It's pretty cool.
Wow.
you guys will be amazed when you see when plastic surgeons do procedures, because you think, how in the world are they going to ever bring those things back to look normal again? And they do, just like this. I mean, that's all sutured there, and you can't even hardly tell over here when it's healed. Like this one, where they've taken out a part of the nose. See how nice that looks? Yeah. Plastics are pretty awesome.
They take that dressing out, right?
Yeah.
Oh.
Yeah, that dressing is just there while they heal it.
Yeah.
Yeah, this one here, it shows the dressing.
Okay.
Yeah, it was just over this. Now it's all nice and healed.
Your skin goes over it?
No.
So it's
No.
like a superficial dressing. It's just on top of the
Yeah,
skin.
it's just on top. Yeah, it's just sutured into place over this. So this is where they repaired this, and then they put this dressing over that repair. just to hold it in place. Because I mean, if you can imagine having something on your nose that you need to have a dressing protecting it, how are you going to keep that on there? You know, unless you had something taped. And then tape is, I don't know, it's probably not going to stick real well. So they just suture it on. So sometimes for cranial procedures, they don't put the skull back on. They'll just leave it open. Well, they don't leave it open. They actually don't put it on. They'll implant that part of the skull in your belly until they're ready to put it back on. They want to leave it open to heal. Yeah.
Wait. Say that again.
They leave the bone in your stomach?
Mm-hmm.
Not in your stomach,
Yeah, they just kind of make a little incision and kind of tuck it in there.
in the stomach.
Yeah,
Our body.
just in your belly, in your abdomen.
Oh,
Back
is it
on
like
it,
this?
Well, let's say that somebody gets injured, they're in an automobile accident here, but they live in Oklahoma. So they can do the repair here, but they don't want to put the skull back on. So the best thing to do is actually send that with the patient. And the best way to keep that good is just to make an incision in their abdomen. I said stomach, but abdomen. They just make a little flap and they'll just put it in there. Basically a little storage.
So you're-
just under your skin. Yeah, under your skin, just to keep it basically alive until they're ready to put it back on.
Wow.
Do they have to like sew it in there so it doesn't get lost?
No, because they just, yeah, it's moving around. No, they just kind of make a little, like a little pocket, and then they just stick it in there.
So
it in the
is that
pocket?
kind of like when they attach like your finger to your leg for a little bit, or like, have you seen those? Like
I
they attach a different body part to a different body part while they're waiting for.
I had a buddy that had surgery on his finger, and they started his finger to his palm.
Yeah, I've
So
seen
it would,
them.
like feel the skin.
Yeah.
After the surgery or something.
Yeah, and I can't remember, there's like a certain one that they do that they will suture your finger to your hand. So basically it
He
heals.
cut the tip of his finger off.
Uh,
So just to get it, they skinned the girl back over the bone or something.
just
So,
sutured it, yep.
How do they keep the pocket closed? Just sew a little button on there or something?
Oh, no. They make an incision, they make a little pocket, and then they slide the
Oh, okay.
skull flat basically in there, and they just sew back up.
Oh, okay. And
And then when they're ready to get it,
Cut
which
the
is
scissors
usually
and pull it out.
months, it's a while. And then they'll take it out and put it back on. Yeah, I mean, they can freeze it or whatever, but you want to make sure that it stays. So the best thing to do is just keep it with you. That's the best thing.
don't lose it.
Yeah, we don't want you losing this.
Oh, gosh.
Was there any other ones that you thought were particularly interesting, Shayna, that you looked at?
I mean, I'm pretty sure if you've seen any one of those, you've seen it before.
Yeah, yep. Yeah. Is there any that you guys want to see? Like a thyroid collar. Let's look at that.
I expected that one to have more like ruffly looking shapes.
Oh, look. Oh. So it comes up. There. Still not showing a thyroid collar.
It's also called a queen man's collar.
Oh, yeah.
But I wouldn't put that in there just like that because it will show you her collars.
Yeah, show us all of her. Like that.
Yeah.
Yeah, darn it.
So it says thyroid collar dressing right there above the first picture. Thyroid
Oh.
collar dressing.
now put after surgery, after the dressing.
Well. No, but you get to see lots of different thyroid incisions. Oh, well, okay. You guys have any questions about the dressing stuff? Any of the dressing things? So catheters, tubes, and drains. Catheters, as you guys know, come in different varieties, used for different things. So urinary catheters. They'll put in urinary catheters in patients when they're having urinary procedures done. Sometimes they'll put in just something to drain their bladder, like right now. Like just before surgery, when they're going to have a lot of times when they do GYN procedures, they want to make sure that they don't accidentally nick the bladder. So they'll want to make sure that it's empty. So they'll almost always empty the patient's bladder. But they don't put in a temporary drain like these. They just put in what they call a red rubber or red Robinson. And it just basically drains any urine that's in there. Suprapubic catheters are placed into the bladder through a surgical opening. So those could be like Foley's, Pezzer, which is the mushroom type. You guys seen a picture of that one, right? Malacot, which is wing-tipped. And those just help to keep it in place. They stay in place instead of having a balloon. They stay in place because the way they open. And then they usually will suture those in place, depending on the length of time that they're going to stay in there. Ureteral catheters are placed in the ureters with the assistance of a cystoscope. They are used to decompress the kidneys, identify and protect the ureters during pelvic procedures. So there's a variety of intravascular catheters for venous access, an angiocath. I'm going to show you guys, let's see, a Fogarty is a balloon-tipped catheter. I think I looked for one of those. For sale? No, probably not. Let's see if maybe this one shows one. know if they're gonna show on maybe. Doesn't look like they used one for that. So basically, this is what it does. They use the balloon, it blows up, and then it pulls out any clot that's in the way. Just like that. All right, let's see. So central venous pressure is monitored with a single lumen or a multi-lumen radiopaque catheters. Some of those, the double or the triple lumens, are Broviac and Hickman. Wasn't that a question?
Yes.
They're the most frequently used.
What was it?
The central venous pressure.
Question 21.
Yep. So they help monitor venous pressure. Gastrointestinal tubes are used to aspirate air and fluids from the gastrointestinal tract. Then there's airway tubes, endotracheal tubes, oral airways. So oral airways, anesthesia uses those. Nasal airway, and sometimes they can't go through the mouth. They've got to go through the nose, especially if they're working on the mouth. Tracheotomy tube, chest tubes. The water seal drainage system uses water in the collection unit to prevent air from re-entering the pleural space that maintains the negative pressure necessary for effective respirations. Is that a question? Maybe not. And when we get to that chapter, we'll go over those more, and hopefully I'll find one of those trays. Dale did such a nice job getting everything organized, but now I can't find anything. That's how it works. So passive drains, we showed an example. That Penrose drain is one of them. I wondered if that was going to happen. Ooh, it's eating it. It's vacuuming it up. It's full. Yeah. I know. There. Crazy. How are you guys doing? You guys need a break?
Yeah.
Okay, take a break. And then we'll finish. We don't have much left. A little bit more.
Chapter 7 is brutal to read.
Oh my gosh,
Wow.
Chapter
it
7
is
what?
very long.
To read.
Chapter 7 is, it's like, wow.
Yeah. It's gonna take a while to get through that.
I found out on the Mind Tap though, through chapter 7. It's fairly straightforward because all the stuff you discussed in micro.
Oh yeah.
Yes, it's just, it's like, oh, okay, I remember that.
Just reading it. I try to read the whole chapter before I do the mind tap.
Uh-huh.
And
Yeah.
it took me 2 days to.
Yeah, to get through it, yeah. Well, the problem is every third page you kind of like fall asleep.
Yeah, I couldn't
Have
retain
you
it.
guys done the read thing that it'll read to you?
Yeah, I love that.
Yeah, because I mean, you can listen to it. There's some.
It's funny if you put it down too fast.
I've tried to activate it a couple of times and I'm like,
Oh, not funny. It's just
When I first used it for chapter 1,
Mhm.
now the abbreviations, it'll start saying the states.
I like
It
that.
messed
Or-
up. Yeah. it messed
Yeah,
up all the time.
or
Or in this.
like Rhode Island or RD.
Oh, yeah.
Like, I was like, what?
it's a Mind Tap.
Yeah, so go to Mind Tap,
Okay.
and then when you go to the chapter, let me take a second here. Anytime you see this, it'll read it for you.
Oh, okay.
So like this stuff, it won't.
So Mind Tap.
Or if you click on any of those, it will show up right here.
Okay.
And that's read it. It's a routine.
So you do
And then if you want to change the speed or the language or a man or woman's voice, you go to the read speaker options.
Okay.
And you can like speed it up pretty fast. If your brain reads faster than he's reading, you can speed it up.
Speed it up.
Which is kind of nice. Like if you don't want to read,
Right.
yeah, it's kind of nice.
See, because
to
I
do
could
that.
I could put all this on audio and listen to it.
Yeah, and I forgot how I did it on Thursday. You can download it. So like if you don't have internet access or you don't want to be streaming all your data listening to this read, you can download the whole thing and then have
Oh,
them.
nice.
Oh, okay.
So you could put it on like the app on your phone and then listen to it like at work or something. Could you do
Yeah.
that?
I bet you could.
I'm
I just
sure you
put it in
can.
a file and I just have the
Yeah.
chapter in a file.
I downloaded mine on my phone, so like
Yeah.
driving somewhere.
For this corrections,
Uh-huh.
I forgot them. I have them printed out and done.
Oh.
I'll bring them back to you today or tomorrow.
Yeah, just bring them back.
Okay. And Miss Devana sent out a message about stuff she was like,
Immunizations, yeah.
And on mine it said she wanted doctor verification for the varicella.
Yeah.
Okay, I gave her titer results from the doctor that were positive, and I accidentally got the vaccination anyways. So she might be confused, but it was a positive titer.
Maybe so.
So should I just go talk to her after class?
Yeah, just swing by and talk to her. Because I thought, he told me he was going to get that. So.
Yeah. Everything should be good.
Okay. Yeah, and I think they're going to start giving flu shots pretty soon. But if you guys
Oh,
just
yeah.
hold off, as soon as they offer them, you guys can go take them free, I'm sure.
Take them free.
mine already.
Huh?
Or take them free.
It seems like they offer them here at the college, like over there at the HHPC. The nursing program does it.
Should
or-
have waited for the free one.
Yeah.
I didn't know they did that.
There's several places that offer them free. I think the hospital offers them free, kind of like a certain time.
Do we know anything about the dates on the observations yet? We know the orientation is going to be the 17th.
Yeah, no, we don't. Not yet.
Okay.
We're gonna go on the 17th, I hope. And then after that, I'm gonna schedule you guys to go for a tour of the OR.
Oh, okay.
Okay, and I'm gonna try to do it around class time. I hope. Okay. I think we can. Probably like an afternoon to go for a tour of the OR. So that way when you guys go for observations, you'll know where to go.
Know where to go.
Yeah.
That always helps.
And then after that, we can start scheduling them.
Okay.
Okay. So just let me know like days that work well for you and I can try to send you on one of those days.
Okay.
Okay.
All right, sounds good.
But what's the answer supposed to be?
Well, that's what's the
Supposed to be dissection?
Oh, no, that's the sponges, cause I saw tonsils come in 5, kidney comes in 5, and like, ones are 10, grade check or overflows are 10, and laps are 5.
Yeah. So I need to go in and look at there's the answers that are on the test because there's only like, 4 of them. But I know one of them is laps and then something else. And so it's like, well, it could be either one of those. So I need to go in and change one of the answers so it's, there's only one option. Yeah, so as long as you know how they come, Raytex come 10s, dissectors 5s, you'll be fine.
Yeah.
All this each one is 1, I'll ask for the English. 2 is drainage of the urine. 3 will be insulation of irrigation fluid or medications into the bladder. Right here, this is right here, the 2 4 is 2 quarts. So one meals can be used for food inflation, 1 is a drainage unit. The 3-way has an additional 1 for insulation of irrigation fluid and medication.
Okay.
Well, that's cool. So fluid catheters contain a thermometer in the tip that's used to measure the patient's core temperature.
I'm going to give you guys until like Wednesday morning at 10 to get your presentations done, okay? I'll just give you a little extra time just in case. Because, well, it's not that they're so long, it's just that it takes time.
I want to take a brain scan.
Brain scan?
Yeah, the brain scan.
So how does the Penrose drain work? By capillary action?
Is that kind of like how the cigarette works, capillary action? Or is the Penrose the same thing as the cigarette?
I think so, yeah. That one says it's by wicking action.
Yeah, the cigarettes.
Basically the same. Yeah, cigarette.
I'm pretty sure it's not that one. Or that one.
So active drains work by basically the pressure, you remove all the air out of, like I was showing you that, okay? So it slowly opens up and sucks out, whatever. But it's a slow process, so that's how it works by active. Those are considered active drains. And they're always connected to some kind of a device. Those ones in that picture on 287,
Mhm.
the one that looks like a grenade. That one's really, you're going to see Jackson Pratt for several different types of them, but that's what we call that one, is a Jackson Pratt or JP. Okay.
The grenade.
Or they might, I'm sorry.
Which one you call Jackson Pratt?
That one that's on 287 in that picture, it looks
Oh.
like a grenade. And it is, it's about the size of a grenade.
You call the grenade a Jackson Pratt?
Yeah, Jackson Pratt, JP. And it's real common because it's small, and then they'll just tape it on the patient. Irrigators and syringes. So syringes, I showed you guys Lure Lock, and then there's slip tip or plain tip. Let's see. Of course, they come in a variety of sizes from 1 to 60 cc's. A fluid can be held in them. And then the Asepto, remember I showed you that one?
Yep.
That's also considered a syringe or an irrigator. It's an irrigating bulb, and it holds up to 120 cc's. So if you're ever asked that, it's 120 cc's.
They're always the same size.
Yeah, those ones
Is
are
that
the
the
Asepto.
Asepto?
Yeah, the turkey baster.
Turkey based.
And then the ear syringe, you know, like the ones they use on little kids to suck out their boogers.
Oh, yeah.
Those, okay, but those are not removable. They don't have like a removable head on them. And they will, when you do a C-section, they use those little bulbs on the kids to clean out their nose and their mouth.
Those things are probably gross.
Yeah, they can get gross.
What are they called?
Ear syringe
Ears.
or ear bulb. When they do maybe some ENT procedures, ear, nose, and throat, they might use one of those types of syringes. Otherwise, Asepto's used for pretty much everything. Okay, so C-sections on babies and then ENT. All right, you guys have any questions about anything, any of this chapter? Just when you thought this chapter was bad, we go to one that's much, much worse. I'm trying to schedule a time when we can go to Central Sterile at the hospital, so that way you guys can see it, because it's pretty impressive.
I
Yeah.
know the only thing at the hospital is October 17th, correct?
Yeah,
Okay.
and you guys you took care of your immunizations,
Yes.
everybody?
Hopefully.
Yeah. If you have any questions, just get with Devonna. She's the one who keeps track of everything. Like, I don't know what she's got or what she doesn't have, so I just leave it up to her. And she'll forget. I mean, she's got a lot of stuff going on, so if you got something and you're like, I know I gave her that, you probably did, and she probably just forgot where it's at or that you gave it to her. All right, so you guys get your presentations ready for, I extended the time until Wednesday morning at 10, so you have until now and until then to get it done.
Presentation?
All right, that chapter's huge, so it'll really help doing these presentations to go over all that stuff. In the very last part, I'll do a PowerPoint for that.
Now, considering the chapter is so big, do you still want us to like limit our presentations, or just cover everything that we can?
You know, they seem kind of long, but when you start going over them, it's not bad. So whatever it takes just to cover your
Just
stuff.
cover this
Yeah.
section.
Yep. All right. All right, you guys are out early. Gives you plenty of time to get everything done.
So what are we doing on Wednesday? We have a test?
No, tomorrow you have your test.